Certain things that may put you at risk of problems related to hemorrhoids would be pregnancy. If you did a job that involved a lot of manual labour and heavy lifting. If you had a chronic condition related to the bowel, so if you were chronically constipated or going to the toilet very frequently with diarrhea, then this can exacerbate problems with hemorrhoids. And if you spend a long period of time on the toilet and strain a lot to go to the toilet, this can be a risk for hemorrhoids. Hello, my name is Rhodri Codd. I'm a general and colorectal surgeon based in Newport, South Wales. I work at St Joseph's Hospital in Newport. Today I'd like to talk to you about hemorrhoids and how they can be treated. Well, firstly, what are hemorrhoids? Well, hemorrhoids are swellings in and around the anal canal. They contain swollen blood vessels or veins. We're all actually born with hemorrhoidal vessels, and they don't cause a problem in the majority of people, but over time these hemorrhoidal vessels can become larger, more swollen, and problematic in some people. Certain things that may put you at risk of problems related to hemorrhoids would be pregnancy. If you did a job that involved a lot of manual labour and heavy lifting. If you had a chronic condition related to the bowel, so if you were chronically constipated or going to the toilet very frequently with diarrhea, then this can exacerbate problems with hemorrhoids. And if you spend a long period of time on the toilet and strain a lot to go to the toilet, this can be a risk for hemorrhoids. Diet is also very important. It's very important to have plenty of fruit, vegetables and fibre in the diet, and also to drink plenty of water. Not doing so may put you at risk of developing hemorrhoids. Well, how are hemorrhoids assessed and diagnosed? Well, I would take a history and discuss how the swellings are affecting you. The symptoms most commonly found with hemorrhoids are itching, some discomfort, occasionally pain, some mucus from the anal canal, rectal bleeding, which is usually fresh and bright red in colour, and you may notice a swelling or a prolapse from the anal canal. I would examine the area, and this involves looking at the anal verge and the anal canal. We perform a finger examination and may need to place a small probe into the anal canal called a proctoscope or a sigmoidoscope to better assess the grading of the hemorrhoid. Hemorrhoids can be managed in various different ways. There are conservative management strategies, so I would encourage a healthy high residue diet with plenty of fibre. You need to drink at least 2 litres of water per day. Bulking agents can be helpful. Bowel habit is also important, so spending short periods on the toilet to open your bowels and avoiding straining are important. Over-the-counter medications containing local anaesthetic agents or topical steroids can be helpful in some people. What are the other treatment options? Well, in clinic I can perform injection of hemorrhoids if the hemorrhoids are suitable for this. This involves injecting an agent underneath the lining of the anal canal, which will destroy some of the hemorrhoidal vessels, reducing their blood supply, and it can be very helpful for patients who predominantly have symptoms such as itching and bleeding. Similarly, rubber band ligation can be performed in a clinic environment. This involves putting a rubber band on the base of the hemorrhoid. This cuts off the blood supply and again reduces bleeding, itching and some element of the prolapse. If the hemorrhoids are larger and more problematic, then surgical techniques are available. I can offer a technique called THD, which is transanal hemorrhoidal dearterialization. This involves placing a probe into the bottom end under a general anaesthetic. It has a Doppler probe which listens for the blood supply to help us identify the areas to target with sutures. We can cut off the blood supply with these sutures and also perform a running stitch within the anal canal to help pull the prolapse of the hemorrhoid back inside. It's a very well tolerated technique, very low risk of pain. It's done as a day case operation and the complication risks are very low. The other technique which I can offer for grade 4 hemorrhoids would be a hemorrhoidectomy. This is a more traditional operation which is performed under a general anaesthetic or a spinal anaesthetic. It does involve cutting away the hemorrhoids and tying off their blood supply. It is a painful procedure, but very effective procedure. The complication risks are slightly higher than the THD approach, but the risk of recurrence with a hemorrhoidectomy is very low. If you'd like to speak to me about problems you may have with hemorrhoids, to discuss treatment options, then you can book an appointment to see me via the Doctify website or via the St Joseph's Hospital switchboard. Thank you.